Welcome to the Healthtech Marketing Show Live. I'm Adam Chirinas. I'm your MC for today. So today's event is the Evolving Healthcare IT Buyer Journey. So in a lot of the work that we do with clients, what we frequently see is that many healthcare IT marketing departments and sales groups still struggle with how to best define and how to best understand the buyer journey. And so we're going to dive into some new research from HIMSS today, which I think will help provide some useful benchmarks, some really helpful data. And to bring this to life, we've also invited some CMOs to join us, and we'll welcome them to the stage shortly and introduce them. So before I bring everybody to the stage, let me just do a couple of housekeeping things. So first and foremost, yes, this is being recorded, and the research as well will also be shared with anybody who's registered for the event, and that will be shared out next week. You'll also be able to listen to the episode and watch the episode through the Healthtech Marketing Show podcast. You can subscribe on Apple or Spotify or whatever your favorite podcast episode is, and it's on YouTube. And then also we'll be creating a blog post which summarizes the event. Now, last but not least, we want your questions. So if you have questions, put them in the chat, or if you're watching on LinkedIn Live, put them in the comments. I'll see them come through and I'll select some of them to ask our panel today. So with that, I'm going to bring our guests to the stage. So let's do that. So far we've got, ask you guys to take this off mute. So far we've got Karsten and Matt, hoping, unfortunately, Lizzie Feliciano was not able to join, and we're waiting on Kaycee. So with that, Matt, why don't you say hi and introduce yourself, tell them a bit about yourself.
Absolutely. Yeah. And thanks for having me today, Adam. This is great. Thanks, Karsten, for participating. So, hey, everybody, Matt Carollo. I am with HIMSS. I work in sales enablement at HIMSS. So I work alongside the sales teams and operations teams and content teams to build marketing programs that meet the objectives of our clients. So the research that we're going to be going through today really helps us kind of build those programs out based on what the audience is looking for. And I'm really excited about participating in this discussion today. So thanks for having me.
Good to have you here. Karsten.
Adam and Matt, to the audience, good afternoon. It's a beautiful day here. And what's really enjoyable is to learn and really discover what research is coming to light to help us as marketeers be better connected and be more relevant in a world that's moving faster. Today, I'm the Chief Marketing and Experience Officer for Equum Medical, but have been a longtime participant in HIMSS meetings around the country and HIMSS meetings around the world. So I realize what importance that has to us as marketeers to connect us to the end buyer and buyer group.
Thank you. So for those of you who don't know me, I'm Adam Chirinas. I'm the CEO of Health Launchpad. We're experts in health tech marketing and sales, and my agency specializes in account-based marketing, and we also provide content marketing, SEO, PR, and sales enablement services. And our clients include established firms like AMN Healthcare and InterSystems. We also work with venture-backed companies like DeepScribe AI. Those are just some of our clients. Now, on with the show. So I'm going to hand over to Mr. Matt, to Mr. Carollo to go through the presentation. And I'm going to go back to the first slide. Sorry about that.
Great.
Over to you, Matt.
Yeah. So this is the Hit Buyer Survey. So if we actually go to slide 3, I just want to go through kind of the overview and the methodology behind this research. So if we advance just a few slides, I think it is. We conducted this research in December of 23, and the purpose behind it is to gather feedback on how the buyer's journey continues to evolve. We did the same study last year, and we did a similar study back in 2018. And we're looking for trending information from year to year and looking to understand which roles and functions are part of the technology purchase process. So you'll see that it's not an individual, but rather a group of stakeholders that we define as the buyer collective that are involved in this process. And we also want to see how many people are involved in the decision-making process when it comes to upgrading or implementing new technology. And what's the typical investment life cycle look like today? So lastly, we want to talk about the content needs and understand the content needs of these potential buyers when they are researching this new technology. So we received 86 individual responses to this survey. We leveraged a third-party platform that validates those responses. And HIMSS was also identified as the sponsor of this research when we went to market. So if we go on to the demographic profile, you'll see here that we have a representation of different company sizes and different job titles that represent the responses. The company sizes here are represented by employee size. So large enterprise is 5,000 employees. Over 5,000 employees. Median enterprise between 100 and 5,000 employees, and small business being less than 100 employees. And you'll see that job titles represent different roles that make up that buyer collective that I was mentioning on the previous slide. And then if we dig a little bit deeper into the profile of the respondents, 81% of the people who took this survey told us that they were either a primary decision maker or part of a group making decisions or have significant involvement or influence over those decisions, right? So these are people that are actively in that group that are making decisions around these purchases. When it comes to titles, the top 6 titles here represent 64% of responses. And you'll see that they range from CIOs to IT managers to CEOs and presidents.
So, Matt, I'm going to just cheat a little bit, and I actually did cheat a little bit. Kaycee, who's on with me as well, Chief Marketing Officer of Premier, we got a first look at this, and the first hat I put on wasn't to be here to collaborate and walk through this, but it was as a marketeer to understand how can we use this. And the word that I circled was buyer collective, right? This isn't an individual buyer, and I think your research has teased out some very interesting things. But also this is HIMSS. And when I started, I said, yeah, I've probably been to HIMSS at least for a decade, if not more. And through that, health information technology has evolved dramatically, right? We've gone from systems that didn't operate to meaningful use, to EMRs, to clinical decision support. For me, one of the discussions I really enjoyed having with you, Adam, and Kaycee was, what does HIT mean in this context? And so for the audience listening, if I came from an AI company, or if I came from a CDS company or technology company, how do I apply this to how I'm marketing?
Yeah, so it's a great question. And the definition, to your point, of healthcare IT has evolved, right? And I think today it's really based on the digital transformation that's happening in organizations that's aimed at improving patient care and ultimately outcomes. So that definition evolving from, like you mentioned, traditional EHR systems to interoperability and data exchange, sharing seamless data across different providers, payers, patients, and so on, to telehealth and remote monitoring and wearables. And like you mentioned, artificial intelligence, of course. This is an all-encompassing definition, and it's applicable to everybody across the board.
Great. All right, let's move on. There's some quite interesting chatter going on in the chat about so people quite surprised at who's coming up, who's not coming up. We may come back to them later, but I do want to dive into the findings. And also, hey, Kaycee, good to see you here.
Hello.
Just give a quick intro.
Yeah, sorry guys, I'm coming in hot. I was on the 4th floor and had to get to the 10th floor, and the elevator wasn't working, so I took the stairs. So here we are. Technology is awesome. So hi, everyone. Thank you so much for having me. I am Chief Marketing, Communications, and Brand Officer of Premier Inc., which is a healthcare technology company serving providers across the continuum of care, as well as life sciences and device companies with data, technology, and services. So thank you for having me. I'm so excited to dive into these insights.
Thank you.
Cool. So let's start with the first thing we wanted to understand here is where the buyer collective has gone in terms of how many people are involved when considering a technology investment. And you'll see here that for the most part, most organizations, there are more than 5 people involved in the decision-making process. 6 in 10 of these organizations are reporting that 5 or more people are part of that process. And 27% of those organizations say that 10 or more people are involved in the decision-making process. So there are many different stakeholders that you need to consider when thinking through your content and marketing strategies. When we look at the makeup of those buying teams, their responses show that multiple functions are part of that tech buying process as well. So while IT is leading the way, a collaborative effort is really evident here and encompasses executive leadership, finance, clinicians, and operations staff. And so this multidisciplinary approach really underscores the complexity of these buying teams when it comes to making these decisions and purchasing technology. So this one is interesting because when we look at the trending information, back about 5 years ago when we asked the same question, 51% of the respondents reported the length of the buying cycle being 12 plus months. When we look at it today, and this is very similar to responses that came in last year, almost 70% of companies report that the typical technology investment cycle is 13 plus months. And half of those companies are saying that the life cycle is 2+ years. So this is a major shift that has taken place over the past 5+ years. And it's gone from half of the organization saying 12+ months to now half of them saying that the buying cycle is 19+ months. So this is really important because the shift in that the life cycle affects your go-to-market plans, and it affects your approach to how you tactically market and really forces marketing teams to think about who they're marketing to, right? So not only in terms of titles and functions, but in terms of what accounts you want to target when you go to market.
Kaycee, I think you had some perspectives on this.
Yes. I'm like, Adam, you got to tell me when I can chime in because I'm just
Go.
in a candy store right now with these insights. This hits really the complexity of the buying committee. And I know Karsten's got insight on this too, but the complexity of the buying committee along with the length of the buying cycle, for me, really, it reinstates why we are spending much more on account-based marketing today than we have in the past. There are more decision makers, more influencers, more individuals involved with evaluating a purchase, no matter really how big or small it is. And so that, of course, is probably extending, in some cases, the length of the buying cycle and making it incredibly more complex. So to make that really, really real for everyone, what that means to us is that we need an account-based strategy using, in our case, artificial intelligence with targeted accounts to say, okay, mine for any sort of insight or intent in those accounts, but also be able to surface information at the right time about what solutions we have to their problems, but in a highly customized way that is specifically related to the job to be done of the person on the buying committee, right? And so it's very much about a content strategy and content journey and deploying those insights and messaging to the right person at the right time. I'm going to stop there. And Karsten, I know you've got more to say.
No, the goal is, I think you said exactly the right stuff. I'm just going to amplify it. To me, I think about actually being a growth officer or consultant in a 24-month period, right? Just imagine the complexity. You have CEO executive turnover at an all-time high, which could lead you to seek out an executive sponsor that then departs. And you're not only going to be at the peak of information understanding about a solution, while at the same time, 30% of your buyer collective may need to start from the ground floor again. So conditioning access to information, and you said it spot on, Kaycee, account-based marketing, making sure that as a marketeer, you're providing a suite of solutions to your commercial team that can be accessed at any point and interchangeably because of that dynamic. I think that's really, really a good point.
Before we move on to the next section, I've got a couple of questions actually I just want to pop in here. Sorry, Kaycee, that's going to make you disappear there. Actually, I'll tell you what, I can probably just move it to, there we go. So I think this is related to the sort of change in the buying cycle. So this is from John Moore from Chilmar. Is that due to diminished sense of urgency to deploy new technology or to meet new regs, or just as not as much immediate need for many of the solutions being acquired today versus a couple of years ago? I don't know, that was actually, you got at that in the research, but I'm very curious to know what your collective perspective on that is.
Yeah, thank you so much, John. And it's really good to see you again. John and I were just on yesterday. I'll start. I think it certainly in the healthcare environment, regs guide and create a sense of urgency for health tech investments, right? And we just recently went through one where we had a solution to HCCs, and which is coding and documentation, that was a regulatory requirement, and then they kind of clawed back the requirement. And so you'll see stops and starts in buying cycles, some related to regs, but it's very, I would say, hard to predict unless you see some volatility in support of those regulations. And then what I would say, or just not as much immediate need for many of the solutions being acquired today versus a couple of years ago. My perspective on this, you guys, is that there's a lot of vendor consolidation happening in the market. I think that providers are, particularly the provider buyers, are so strained with staffing challenges and labor and financial struggles in many cases that they're really looking at their tech investment across the portfolio and saying, how can I consolidate these three things into one solution that maybe even is second best on the list, but is one single solution for all of those capabilities and decreases my financial investment. That's my perspective.
Just one other quick question here, Leslie Becker. What is the average revenue for the buying cycle? I don't know if you captured that data. Yeah, it's harder because it's going to be all over the place. But I'm just curious, actually, just to sort of sense, are you seeing, average deal sizes go up, down, sort of?
I mean, Karsten, you weigh in. Based on what I just said, I'll reiterate, we're seeing more enterprise level deals from hospitals and health systems where they're coming to us and saying, we have a cost imperative and we need you to help us take that cost imperative out, and having us put together as solution architects a deal that involves consulting and technology and a lot of different other capabilities that help them get to a number.
Yeah, I mean, we can gratefully say COVID is in the rear view, but that doesn't mean that we've replenished the resources or hospital assets to be a new company or a new hospital organization. I think vendor consolidation is going on, but we're also seeing hospital mergers at a mega size going on. And so there is some conservatism that I would expect is making those deals longer. And of course, we have to move from what do we have in legacy positions, which was acquired through COVID, which was more of an urgent buying cycle, to one now where there's more careful and deliberate planning influenced by tighter wallets. So I certainly agree with that.
Great. Thanks. Okay, let's get back to the presentation. And now we're going to go into content.
Yeah, so this is kind of a great slide just based on what we were talking about. So we wanted to understand how content consumption is shifting. So again, looking back 5 years ago when we asked the same question, over 50% of respondents said that they were seeing content that was too product-oriented or too sales-focused. But when we look at responses today, 86% of people are saying that product demos are important to them when they're researching a potential tech vendor. And you'll notice that number 2 is vendor-focused content like case studies and white papers, for example. So we saw the same types of results last year to these questions, where it's another kind of major shift in the past 5 years or so, where the top 2 on the list are now product-oriented and sales-focused. And the past few years have changed the way that the buyer collective is researching technology, right? This shift has been taking place for years and years, but I think the last 2-3 years has really ramped that up. And the buyers want to see product demos. They want to see vendor-focused content. They want to see research that's useful to their mission and their objectives. And they want to see peer-to-peer content and thought leadership from the vendors that they're researching. And then when we ask them what the most important factors are when selecting a tech vendor, you'll see that proven success with other healthcare customers, interoperability, and privacy and security are at the top of the list. And this kind of goes into, I think, the discussion around the question that just came in. But we were told last year from multiple organizations that 2023 was the year of moving from investment to assessment, right? And everybody was going to kind of take a step back, assess what they have based on their current tech stack, based on, I think Karsten mentioned it, the technology that was kind of urgently put in place during COVID. And they were looking to their current vendors to help them in that assessment, right? So that they could determine the best way forward for their organizations. And you'll notice here that number 4 is customer support, right? These organizations are looking for vendors to be more than just vendors. They're looking for partners who are going to support them and their needs. And then you'll notice at the bottom of the list, cost and deployment times, showing that these are much lower factors when thinking through the most important factors when they're going through the selection process.
Yeah, I think, okay.
Yeah, I mean, John or Adam, if I can just comment on one of the things in the chat related to, and maybe you have some of this, Matt, but related to data, looking at the difference between SaaS and software acquisitions versus tech-enabled services. I think he nailed it in the chat. John did. With the bump in rebadging taking place, it seems like services are becoming a bigger piece of the pie as a way to reduce operational overhead. We're seeing like almost services-enabled tech as a trend, where you're leading with the service is kind of creating the sort of the plan on how to get to the operational number or the savings or the margin improvement. And then the tech is almost left behind as an enabler to that. So I don't know if any of that came through in the research, but I think that's a good point from the chat.
I'm seeing it from my end, Kaycee, and obviously Equum is more on the services side. We see frequently that the rate limiting ability of technology is the clinical workforce, right? Being able to bring the services to make the technology work. And so certainly I think health systems are seeing the combination of people, process, and technology, which allows the solutions to work. The last couple slides, I think, really made up very well. 24 months to come up with a decision and you have proven success with other healthcare customers being 80% ranking, that is trust, right? This is no longer there's a vendor A. This is you're a partner, you're a trusted member of our team, and we're going to do this together. And I think as it speaks to your last slide, Matt, which looked at product demos, which looked at what was prioritized by buyer collectives, it's about getting personal and connecting again and truly understanding what the marketplace has to offer. What I see is buyers are more empowered and buyers are much more participatory in the research than prior years, where the expectation is the vendor will bring me everything I need to know. They're much more empowered conversations, deeper conversations, not only about what does the tech do, but where can the tech take me? And I think that is really back to this idea of we need something not only for today, right, which I think was that COVID mentality of urgency and put in place, to we're designing or redesigning the structure of care delivery, whether it's in the hospital or in a decentralized home environment.
So I just want to dwell on one point, which is, the headline, proven success and interoperability, privacy and security are key to make the shortlist. I think we had a chat amongst ourselves. Those are kind of the table stakes. What are some of the other issues that Kaycee and Karsten, that you're seeing out there that are kind of like rise up to the level of importance in terms of big buying issues?
We got to mention the elephant in the room, right? Which is artificial intelligence. And I did see a little bit of that in the chat too. So I think others are interested. Premier works with about 76% of all providers in the nation. And while their top priorities that are keeping them up at night are things like labor challenges and scalability and financial, creating more margin opportunities or diversification of margin, they do see AI as a key enabler. And I think, of course, interoperability and privacy and security weigh into their maybe slowness to adopt certain things, but AI will be an essential enabler for the future. And I think that maybe folks are in a little bit of a watching and waiting, or we have a lot of different tests. We're doing kind of like wet lab testing with different innovative forward-thinking health systems out there. And it's certainly top of mind if and only if it can address their top challenges. So we'll see as they'll come to us and say, labor is a challenge. How can your artificial intelligence solutions help us cut back on labor, have our docs operating at the top of their license, those sorts of things?
Yeah, I work and talk to a lot of AI companies, and I'm blown away with one company in particular, just blown away by the speed of the adoption. Having run my own software company, I just drool at the success that they're having, but also seeing an inflection point of sort of AI use cases that seem like people would question why. I don't even know why you exist. This year, people are saying, we need you and we need you now. It's amazing what's going on. All right, let's move on to the next slide.
Cool. Yeah. So we want to understand what content is most important, but we also want to understand how this content helps the buyer collective succeed at their job. And we have a call out here as a reminder that 81% of these respondents are primary decision makers or part of that group making those decisions. And while the number one answer remained the same from last year, it jumped over 10 percentage points. So 70% of respondents said that content helps them make informed technology purchase decisions. And when you're thinking about you're looking back at what the content looks like, right? They're looking at product demos. They want to see vendor-focused content. They want to see case studies, right? So they want to see success through those case studies. And they want to hear about proprietary data around particular topics and also hear that peer-to-peer conversation. The others that are high on the list are identifying new emerging technologies, managing current technology implementations to maximize ROI, I think that goes back to the discussions that we were just having and understanding how others in the field are navigating challenges that they may be facing as well. So again, think about case studies here. And then when we look at platforms that were used in the past 12 months, the top 3 information sources are websites, events, and webinars. And you'll notice that both vendor websites and industry websites like Healthcare IT News are at the top of the list. In-person events come in at number 2, and webinars and digital events come in at number 4 and 5. So I think for me, 2 things kind of stand out. The first is that your website really needs to be up to par with today's standards in terms of content and automation strategies and so on. And second is that in-person events has jumped to number 2 this year versus number 5 on last year's survey. So we see in-person events making their comeback here, but I think they're coming back in many different forms, right? So through smaller intimate events to big industry events like HIMSS Global Conference. So creating content that's valuable is the first step, but then you need to make sure that you're using the distribution channels, including your own website, that provide easy access to this information that the buyers need along their journey.
Yeah, I gotta jump in, Matt, because I think this insight is really interesting. It says back to basics a lot to me, but what it also says that Karsten and Adam and I were chatting about is that the website, you almost think of the last phase in a buyer journey and a decision, right? Because when you've got someone evaluating a tech tool, they're likely Googling feature function, maybe landing on a paid search ad or something of that sort, and then going to a website and investigating further, maybe filling out a form for capture. But I really think that saying that the website is the most influential is basically saying like a lot of shopping is happening online. And as marketers, we need to be able, and salespeople, we need to be able to swim upstream and identify that sort of dark funnel activity to see that they're even in the market for a solution and landing on our website and or that of our competitors.
Yeah. I mean, Kaycee, zeroing in on website, when I read that, I don't say, here's my checklist. I have a website and it's got a lot of content on it. It's if my website is passively serving as a repository for content that I'm not doing the best I can as a marketeer to analytically use tools that exist to support intent buying through my website to identify those that may be in month 1 of a 24-month journey, right? If I leave somebody, a potential buyer collective, to independently research my solution and other solutions for 24 months, there's dramatic risk. I want to intervene as soon as possible, help to shape the dialogue and narrative of what I'm sharing with them. So yeah, I love seeing website. I more love seeing events. And the reason why is I truly see that we have rebounded to a world where we want to get personal, and getting personal makes the difference. Those HIMSS booth conversations or post-HIMSS blister size comparisons on the walk home, those are the things that make sure that we realize that we're all human. And over 24 months, that's what builds that trust.
Yeah. It's interesting that this seems like sort of like kind of this slide we spent a lot of time talking about. There's recently 6th Sense, one of the ABM vendors, published a piece of research about B2B buying, which is fascinating. Really, I strongly encourage anybody to go find it. And a couple of stats that came out of it. One stat is that B2B buyers don't reach out to the vendors until they're 70% of the way through their process. I think that's sort of generally kind of well known. But here was the really shocking fact is 84% of buyers went with the first company they called. That doesn't mean that they're lazy and they're just that's the way that they go, that they're easily influenced by the first people they talk to. It's they've made their decision by the time they talk to you. So as marketers, it means our job is to help the buyers do their homework and put out as much, make the information as helpful to them and to put it out there as much as effectively as possible. And that's why it's so interesting to see webinars rise up to number one.
Because we have to be efficient too. I mean, Kaycee, for me, for sure, I don't have unlimited resources. So if I say, go hit this scattershot market for marketing, that's not very effective and efficient. If I have those tools that say, look, here is an ideal customer profile that's really interested and curious, let's engage now. And what's so interesting in what you're saying, Adam, is if we were to reach out to a customer that through intent data is researching us actively, that first conversation is so much deeper because it's not about who are we, it's also why is our solution right for you? And I think that's really where we can leapfrog some of the earlier concepts of a website, but also earlier upstream engagement, as Kaycee said.
Yeah, is that the early stage conversation shouldn't be what do you want to buy? It should be how can we help, right? What information would be helpful to you?
I love that. And I also think we can use the term website a little loosely here too, right? Because there's your kind of corporate, I mean, we have a ton of different SKUs, I'll say, since we have commercial people on the call. But when you think about specific tech applications, capabilities, AI, there are also ways to build using some pretty agile tools, front-facing websites for that specific product or product page or solution. And then to make sure that through a digital journey and touch point, they're reaching that specific page that honestly maybe even compares you to your biggest competition or gives them a downloaded buying guide that they can use to evaluate the solution. So I think I agree with the sentiment that this signals that buyers know what they want. They know the vendors in the market that they're shopping in, and they're voting with their keystrokes in visiting your website. And so that you've really got to have the content that is precisely targeted to them and the needs that they're searching for in order to capture their interest.
Yep. And to that point, valuable content.
Yeah, I mean, great. It's a great transition here. So yeah, I mean, looking at what people are doing after they find what they define as valuable content, 93 of the respondents here told us that they took action in the last 6 months after finding valuable content. And that action varies, right? So we're talking about kind of that direct outreach, but the top 3 actions consisted of researching a product or service online, right? So going back to, coming across something and then going into Google and searching it, right? And seeing what comes up. Discussing or forwarding that content to a colleague. So that kind of peer-to-peer conversation. And then number 3, coming in at reaching directly out to a vendor, right? So this is really, I think, reflective of the overall journey, right? Starting with awareness via content, all the way through to reaching directly out to a vendor, right? And starting that conversation. You'll also notice here that a third of the respondents are including content that they find online as documentation to make the case for their tech investment. So again, this aligns with product-focused information, case studies that show return on investment, so that they have proper documentation to go and make their case to the collective. And then talking about trust, right? So we asked them about how they're accessing information, but we also want to understand what sources they trust. So these kind of bubbles here represent the top 5 responses, where respondents said that these sources were either extremely or very trustworthy. And this aligns with everything that we've seen in the previous slides, right? So at the top of the list is in-person events, at 80%. And of note is that that's up to the number 1 spot from number 4 last year. So it kind of correlates to that previous slide, followed by associations and industry peers. Then comes digital events and webinars. And you'll see on the bottom right here, 40% and 39% respectively of respondents also said that industry websites and newsletters are extremely or very trustworthy.
Interesting comment here from Amy Berger. Interesting that peer influence is lower than in-person events.
Yeah. And you know what? Last year, industry peers was actually at 83% and in the number 1 spot. So I think it's interesting as well.
I'd be really curious if Karsten and Kaycee comment on the trust issue and sort of your perspectives on that.
I learned to look at the chat, and so I've just been catching up. So that's what my eyes start moving left and right. What's interesting is there's trust, and the other is making sure that trust includes a buyer understanding, right? And we have 80% in-person events, 71% association industry peers. If I bucket those together, kind of a Venn diagram, you say, sure, we meet peers. I've been at HIMSS where, peers of mine from legacy organizations join to see a new vendor, and we both go look and we both explore together, and we hear what we each think. The other side that I look at here is I started this conversation about asking Matt, how do we define health tech, health IT? And we saw it as an expansive term. As marketeers, we also have to appreciate that we're probably thinking and defining things more granularly than our customers are. And so rather than just trying to solve a problem that we think the customer has, I really think we need to start by making sure we understand what our customers' wants and needs are. Are they defining telehealth the way that we define telehealth? AI the way that we define it? And through that, again, as we see the aspect of being genuine, which is the in-person event, and consultative by bringing in industry peers and references, I do agree with you, Adam. I think we've gotten back to a 24-month relationship cycle, not a buying cycle.
Yeah, Karsten, that word is so key, relationships. And I think that's what this slide is all about. I do think that as a marketer, we are really saturating our buyers with so much digital, and we're, one vendor of hundreds that are trying to get their attention and mind share, that people are ready to get back in person and engage, like you said, authentically and build relationships, see it, ask for a double click down on tech that they find interesting, maybe get their hands on it through like a learning lab type experience, and really just engage a little bit more authentically instead of us just giving them the proof point of the month in a digital ad. So that to me is just, that really rings true. The relationship aspect, I think, is just more important than ever.
So there's a very interesting, it's a slight change in the subject, but I think it's a very interesting topic on an area from Donna Casano. There's a health tech company recently spoke with, which is betting all on industry influencers. I'm kind of curious. I guess that's analysts. So you got John Moore out there. John Moore says, we personally find that trusted peer influencers are quite impactful, that they need to be seen as more than just a mouthpiece for the company. That's a good point. Do you guys, how does sort of the notion of, how would you define influencers for your business, and where does that fit in?
Go ahead, Kaycee.
No, I was going to say the same to you. I mean, I would say I sort of see this in 3 buckets. I would say the first bucket are the John Moores, or the industry analysts that have reputations and use real data to drive their insights, and they're unbiased and all of those things, which are excellent and wonderful tools. The second bucket, I would say, are really like your customer ambassadors, and those that have a voice in a platform and are going out, whether that be paid or non-paid, and telling your story to their peers. And the third are just super cool people that have like millions of followers that you kind of want to tag you and say that they think what you're doing is cool. We're experimenting with all three. I'd say the first two have proven a little bit much more of an ROI for us. Certainly having that unbiased report that says, here's how we measure up to our competition is so incredibly helpful. And we have some projects like that underway. And then secondly, just having a chief information officer, technology officer, chief medical information officer as on a platform about your products and solutions and telling their peers in an organized way is, I mean, you just can't beat that.
Yeah. And again, I won't stick to the 24 months, but we also have to realize that it's a 24-month statistic plus a minimum of 6 individuals within a buyer collective, right? Making a decision. So just like in our classrooms as students, people learn in different ways. People consume information in different ways. And so over those 24 months, as Kaycee, as you're rightly mentioning, any type of top of funnel market engagement, buyer collective engagement needs to have a pretty resourceful approach to content, right? And how we approach that content, from the webinars and the websites to, hey, I'd like to introduce you to X person who may be an influencer. We have some absolute industry titans that have experienced everything from single hospital design to hospital infrastructure design. And it's not as much just tell me that this is the right solution to go with, but show me that you've been on this journey and show me that you were successful. And that, I think, comes full circle back to, I've checked off a buyer group checklist of, did I research it on a website? Sure. Did I meet with them at 1, 2, 4 events? Absolutely. Do I know 1 or 2 customers or competitors that have them, but I think it's great? Yes. And lastly, show me somebody who really is potentially, that's the definition of influencer, somebody who's used this, that's interpreted the value of the HIT solution into a hospital like mine, right? If I'm a critical access hospital, I don't want to really hear what Mayo did with Epic, right? It may not be the right, alignment. I want to hear, show me a hospital like me that's benefited from X solution.
I think, yeah.
I was just going to add, Adam, because there's a note in the chat from Donna, and Donna sort of started, thank you, Donna, for starting the influencer conversation. She asked if I would bet the business on an influencer doing a product comparison. I think, you guys, what we're hearing through this research is that you really can't bet on any single tactic to get the job done. And even what we're looking at right now, like, what is this last touch attribution, right? Like, is this first touch attribution? You probably need a mix of all of these things, given there's so many distractions today for these buyers. And by the way, if your return on investment story doesn't hit home, then none of it works. So I think that testing certain, we use an agile marketing methodology, and testing certain things in the market is the best way to go. But it's got to be followed up and amplified with other tactics. You just can't do a single blitz.
Yep. Yeah. I think the other thing I would add into it is the notion of communities to help market. And I mean, the one that kind of swings to mind is HIMSS. Just, HIMSS, it's a website, it's a publication sort of, but it's really a community, and it's a very influential community. And it just, so I'm not sure whether it's an influencer or a community. It's sort of both, really. I'm kind of curious, do either of you use community building as part of the way that you build your businesses?
So quite recently, we actually published an article in Forbes about what we view as the partner flywheel effect. And really what I see is organizations, larger health systems, are trying to seek out disintermediated partners. And those disintermediated partners are by themselves a partner collective. And the reason why is, as we specialize and build new innovative technology or proprietary ways of bringing solutions to market, hospitals really, I think, find the one-to-one relationships very inconvenient. So if there are ways where we can bring or knit together 3 or 4 disparate offerings that combine to be more powerful, and deliver it as such, which I think is that partner flywheel effect, I personally do see value through that.
Great. Excellent. Okay. So we're coming to the end here. So Matt, why don't you go through the key takeaways, and then I'm going to go to Kaycee, then Karsten for some final thoughts and perspectives before we wrap up with any remaining questions.
Yeah, sounds great. So we tried to boil this down to 5 key takeaways. So the first is the buyer collective in healthcare is growing in both size and complexity. And again, 6 in 10 organizations report that 5 or more people are part of that tech buying process. And 27% of those organizations report that there are 10 or more people involved. And these people work across a variety of different functions. The number 2 takeaway is the length of the buying cycle for tech investments. It has increased, with over 50% of companies now saying that the buying cycle is 19 plus months, with a big portion saying 24 plus months. Number 3 is around the content that's important to the buyer collective, and that now includes vendor-specific information. So now 86% of respondents saying that product demos are important to them when they're researching technology, and then followed by vendor-focused content. So again, case studies and white papers. And towards the top of the list as well is that peer-focused content and research. And then number 4, the key to making the shortlist being proven success and interoperability. But again, another note here is that custom ranks number 4 in the most important factors. And healthcare tech leaders are not just looking for vendors, they're looking for partners who could provide that support that they need. And then finally, informing the buyer collective. I think Kaycee said this earlier, right? At the right time, with the right content, on the right platform, making sure that providing access to information across these different platforms that they trust will drive action, right, amongst the buyer collective, and ultimately help them collect the documentation and get approval for making that purchasing decision. So that's the 5 key takeaways from me. I'd love to just close and say, hopefully to see everybody at HIMSS in Orlando next month. And thank you again for the discussion. This was great.
Great. Well, we're not quite wrapped up yet, Matt, but thank you for this. This is great. So you did a great job presenting that. Thank you. And really appreciate you doing the research.
Yeah.
Kaycee, any closing thoughts for us?
Yeah, I thank you so much, Matt, for the research. And it certainly posed some questions and really sort of validated some of what we're testing in the market right now. I guess I would close with a little bit of altruism and say that if you are in the market of wanting the attention of healthcare buyers, we're all sort of trying to do the same thing, right? Like, we have to bend the cost curve. We have to improve the quality of care, and we have to ensure that providers have better margins in order to get to innovation. And so, like, the old model of everyone going at it alone is just, the market's too saturated for that. So let's figure out ways. Karsten and I have been on phone calls like this where we're like, let's work together on certain things. Let's figure out ways where we can work together and go to market as cohesive and creative solutions and tack on to each other's successes, because we owe it to these buyers to really accelerate the infusion of innovation and adoption of technology so that they can deliver that value onto their patients. And I work for one of those companies that certainly has a lot of scale and can bring things to market quickly. So I'd be happy to chat with anyone who wants to follow up on that.
Thank you.
My turn?
Yeah.
Okay. So I'm a marketeer, and we have this brilliant piece of data, which I've already taken screenshots of because I want to use it. At the same time, what's not here is also just as important. What we don't have here is data on workforce shortages, physician burnout, redistribution of hospitals into decentralized models of hospital at home. So patients are moving. So think about applying what Matt and HIMSS has done to these things that aren't in the survey, which is the things that we don't see here. And so to that end, we should, as Kaycee mentioned, let's be altruistic. Let's keep the patient at the center. Let's figure out how our solutions solve it, because ultimately that's what hospitals want to do. They just need to do it more efficiently. And hopefully we can help them do that.
Thank you. So before I close things down, I just want to do a couple of mentions. First of all, this is the Healthtech Marketing Show live. You can subscribe. So the podcast has now been going for a year. We've got about 40 episodes, and you can subscribe on Spotify and Apple. We interviewed Kaycee on agile marketing. We talked to Karsten about trust and brand and stuff like that. We've had folks from HIMSS on there. The other thing is we've got more stuff like this coming up. So at the end of the month, on the 28th, we're going to do a workshop. It'll be a 90-minute workshop on how to use AI for marketing. So we're going to show you how you can use Gen AI tools to do things like write content, write personalized emails. We'll even talk about how you can use Zapier to integrate it in with things like with Salesforce and other things like that. So just a couple of plugs. With that, I'm going to say I want to give a massive thank you to Kaycee and Karsten for taking the time and being so candid and thoughtful with your perspectives. It was great. And I can see just the banter going on in the chat reflects that. And then a huge thank you to Matt for making this research happen, and to all the fine folks at HIMSS for all that we do. You've been a sponsor of this program we've done together for a couple of years now, and I'm very, very grateful to you for that. So, and then lastly, I want to thank everybody who attended. It's been just wonderful seeing the chat going on. I think there's been a kind of parallel meeting going on in the chat, which is great, which means that your research and the discussion got people talking. So with that, I will shut things down and bid you all adieu and hope to see you on the next one.